Look, I want you to imagine something for me real quick. You're sitting in your doctor's office, right? You just had a routine checkup, nothing crazy, just making sure everything's working the way it should. And then 2 weeks later, you get a bill for $347. And you're staring at this bill thinking, wait a second, I have insurance. I pay $250 a month for this insurance. What am I even paying for? Here's the thing. If that sounds familiar, you are not alone. According to KFF's May 2025 health tracking poll, about 1/3 of adults say they skipped or postponed needed health care in the past year because of the cost. And this isn't just uninsured people. Insured adults also report skipping care because of cost. So today, we're going to break down exactly why this is happening, how insurance companies have basically gamed the entire system, and what you can actually do about it. Because here's what most people don't realize. Understanding how your insurance actually works could save you thousands of dollars a year. Okay, so let's start with the big one, deductibles. Now, you might be thinking, yeah, I know what a deductible is. It's the amount I have to pay before insurance kicks in. And technically, you're right. But here's where it gets really interesting. Over the past decade, deductibles have absolutely exploded. According to the Kaiser Family Foundation's 2024 Employer Health Benefits Survey, the average deductible among workers who have one is now $1,787 for single coverage. For family coverage, we're talking deductibles in the several $1,000s range. Let me put that in perspective for you. The median household income in America is about $83,730 according to the latest census data. Let's use a $3,000 family deductible as a realistic example in that several $1,000s range. That represents about 3.6% of that median income. Before insurance pays a single penny, you're dropping nearly 4% of everything you earn that year. And here's the psychological trap that most people fall into. When you're signing up for insurance, usually during open enrollment at work, you're feeling healthy. You're thinking, I probably won't need to go to the doctor much this year. So you pick the plan with the lower monthly premium and the higher deductible because, hey, you're saving money every month, right? Wrong. See, insurance companies are counting on this exact thought process. They know that statistically, most people will need medical care beyond just preventive visits in any given year. CDC data shows we're averaging a little over 3 office visits per person annually. And here's the kicker. Most of those visits don't count toward your deductible as covered preventive care. Let me give you a real example. Sarah, we'll call her Sarah, she's got a high deductible plan because she's 28 and healthy. Monthly premium, $150. Deductible, $5,000. Now, she goes in for her annual checkup. That's covered, no problem. But then she mentions to her doctor that she's been having some weird stomach pain. Doctor says, let's run some tests. Those tests, not preventive anymore. Now we're in diagnostic territory. Boom, she's paying full price until she hits that $5,000 deductible. Blood work, ultrasound, specialist visit. She's out $1,200 and her insurance hasn't contributed a dime. Now, here's where most people think the story ends. Okay, once I hit my deductible, I'm good, right? Insurance pays everything? Not even close. This is where we need to talk about coinsurance. And look, this is where insurance companies really start playing games with your psychology. Coinsurance means that even after you hit your deductible, you're still paying a percentage of your medical costs. Coinsurance can be 10%, 20%, 30%. It depends on your plan. But whatever that percentage is, you're on the hook for a chunk of every bill, even after paying thousands in deductibles. Here's the math on this, and I want you to really pay attention because this is where people get absolutely destroyed financially. Let's say you need surgery. Nothing exotic. Maybe you need your gallbladder removed. Pretty common procedure. Now, prices for this can be 5 figures either way, depending on where you are. So let's use $25,000 as a middle example to do the math. You've already paid your $5,000 deductible earlier in the year, so you're thinking, okay, I'm covered. But you're not entirely. With 20% coinsurance, you're now on the hook for 20% of that $25,000. That's $5,000, on top of the $5,000 you already paid. Now, you might be thinking, wait, so I could pay $10,000 in a year and I'm still considered insured? Yes, exactly. That's exactly what I'm saying. And here's what really gets me frustrated about this whole system. Insurance companies have gotten so good at hiding these numbers that most people don't even realize this until they're already facing massive bills. The system is confusing in a way that benefits the companies because confusion makes people less likely to challenge a bill. These policies are written in language with terms like out-of-pocket maximum and coinsurance and allowed amount that sound like they mean one thing but actually mean something completely different. Okay, so there is a light at the end of this tunnel, and it's called the out-of-pocket maximum. This is the absolute most you'll pay in a year for covered services. After you hit this number, insurance actually does pay 100%. For 2026, the legal limit for marketplace plans is $10,600 for an individual and $21,200 for a family. Now, here's the thing most people don't realize, and this is crucial. That out-of-pocket max only applies to in-network covered services. Let me break down what that actually means. Now, the good news is that back in 2022, the federal government passed something called the No Surprises Act, which fixed some of the worst abuses in the system. If you have an emergency and get taken to an out-of-network hospital, you're now protected. You can only be charged in-network rates, and that spending counts towards your out-of-pocket max. Same thing if you go to an in-network hospital but get treated by an out-of-network anesthesiologist or radiologist. Those protections are real and they've helped millions of people. But, and this is a big but, there are still massive gaps. Ground ambulances aren't fully covered by the No Surprises Act. You can still get hit with a $2,000 ambulance bill that your insurance barely touches. Or let's say your insurance company denies a claim, saying the procedure wasn't medically necessary. Now you're fighting an appeal process that can take months, and in the meantime, you're getting collection notices. Or, here's a really common one, your doctor prescribes a medication, but your insurance requires prior authorization. While they're dragging their feet on approval, you either go without your medication or pay up front. And depending on how that gets processed, that spending may not count the way you think it should towards your deductible. Kaiser Family Foundation research shows prior authorization problems are linked with delays and higher out-of-pocket costs for consumers, even with the No Surprises Act protections in place. Now, look, I know what you're thinking. This still sounds like a complete scam. How is this legal? And here's where we need to talk about how we got here, because understanding the psychology and the incentives behind this system is the only way you're going to learn how to navigate it. See, health insurance in America wasn't always like this. Back in the 1960s and 70s, insurance was actually insurance. You paid a small premium, and when something big happened, insurance covered it. Deductibles were minimal. But here's what happened. Healthcare costs started skyrocketing, and instead of addressing the root problem, why are MRIs and common procedures multiple times more expensive in the US than in many other wealthy countries? Insurance companies decided to shift more and more costs onto you. Their logic? If people have more skin in the game, they'll be more careful about using healthcare. Except here's the problem with that logic. Healthcare isn't like buying a car or choosing a restaurant. When your kid has a fever of 104 degrees, you're not shopping around for the best price. You're going to the ER. When your doctor says you need surgery, you're not in a position to negotiate. But insurance companies don't care about that. What they care about is profit. And here's a number that's going to make you angry. In 2023, the health insurance industry reported net earnings of around $25 billion, according to the National Association of Insurance Commissioners. That's billion with a B. And profits swing year to year. NAIC shows earnings fell sharply in 2024, but the cost shift to patients didn't disappear. Meanwhile, KFF shows cost is still driving skipped care and financial stress, even among insured people. People who have insurance are struggling with medical debt, delaying care, and making impossible choices between healthcare and other necessities. And here's the really insidious part. Insurance companies have made the whole system so complicated that most people just give up trying to understand it. They see a bill, they pay it, and they don't even question whether it's correct. According to NORC research, 57% of adults have been surprised by a medical bill they thought insurance would cover. More than half of people with insurance are getting bills they didn't expect. Alright, so we've established that the system is basically designed to extract as much money from you as possible while giving you the illusion of coverage. But here's the good news, and this is where we're going to shift into action mode. There are strategies you can use to protect yourself. First, actually understand your specific plan. I know it's boring, I know the documents are like reading steroids regulations in Portuguese, but you've got to do it. Pull up your summary of benefits and coverage. Every plan has one. Find out what's your actual deductible, what's your coinsurance percentage, what's your out-of-pocket maximum, what services are covered as preventive. Here's a trick most people don't know. If your doctor writes something as diagnostic instead of preventive, you're going to pay. So if you're going in for your annual physical, make sure it's coded correctly. If you bring up a specific symptom during that visit, ask your doctor to schedule a separate appointment for it so your preventive visit stays preventive. Second, use an HSA if you're on a high deductible plan. A health savings account is literally one of the best tax advantages available to regular people in America, and almost nobody uses them correctly. You put money in pre-tax, reducing your taxable income. It grows tax-free, and you can take it out tax-free for medical expenses. Let me give you a concrete example. If you're in the 22% tax bracket and you put $3,000 into an HSA, you just saved $660 in taxes. That's money you would have given to the government that you get to keep. And here's what most people don't realize. You don't have to use that HSA money right away. You can pay medical expenses out of pocket, keep your receipts, and reimburse yourself from the HSA years later. In the meantime, that money can be invested and growing. Third, and this is huge, negotiate everything. Medical bills are not set in stone. A lot of people who call and negotiate get some relief, especially if they ask for financial assistance or a discount for paying up front. Call the billing department. Say, "I can't afford this. What can we do?" You'd be shocked how often they'll cut the bill by 30, 40, even 50% just because you asked, or offer to pay in cash up front. Hospitals and doctors hate dealing with insurance companies as much as you do. A lot of times they'll give you a discount for paying immediately because it saves them months of back and forth with insurance. Fourth, always check if you're being charged the allowed amount. Your insurance company negotiates rates with providers. That's supposed to be your main benefit, but sometimes, especially with certain billing situations, they'll try to charge you more than they should. Request an itemized bill. Go through it line by line. You'll be amazed at what you find. $15 Tylenol, $100 boxes of tissues. I've seen it all. Look, here's the bottom line. You're not powerless. When you understand how this system actually works, you can push back. Pull up your policy. Read it, set up an HSA, negotiate, be smart.